Hello everyone, thank you for joining me today. My name is S.Morrison King, and in this video I'll be talking about ethical issues and implication in research communication, especially as they relate to the allied health field. First, let us look at the principle of scientific communication. At its core, scientific communication is about accuracy, clarity, transparency, and integrity. As health professionals and researchers, we need to share information honestly, avoid bias, and present our finding in a way that others can understand and replicate. Doing this not only strengthens credibility but also build trust with both colleagues and community. Now, when it comes to research that involves human participants, there are some very important ethical responsibility. We have to respect patient autonomy, make sure informed consent is obtained, and also protect confidentiality. Allied health professionals need to explain the purpose, risks, and benefit of the research clearly. Following ethical guidelines like those in the Belmont report, respect for persons, beneficence, and justice help makes sure participants are treated fairly and that their rights are safeguarded. Of course, communication itself can present ethical challenges in research. Problems often rise when data is misrepresented, when findings are communicated openly. For example, without resulting that could affect a patient's care can be harmful. That's why it's so important to be transparent, culturally sensitive, and clear in all communication with patients, families, and colleagues. So, how can we put this into practice? With patients and family, effective communication means avoiding medical jargons, using plain languages, and checking for understanding by asking questions and encouraging feedbacks. It also means listening actively and respectfully with others healthcare providers. Communication should be professional, collaborative, accurate, with proper documentation, always within our scope of practice. It is not just about speaking. Written communication matters too. Whether it's research summary, a patient report, or formal correspondence, the written should be professional, concise, and based on evidence. Grammar, tone, formatting matter, but so also does clarity. The goal is to write in a way that any healthcare professional could read and interpret without confusion. In closing, my dear friends, ethical research communication is really about three things: accuracy, transparency, and respect. As allied health professionals, we have the responsibility to uphold these values, not just to protect patients, but also to support colleagues and maintain the integrity of the healthcare system. Thank you for listening, and I encourage us all to keep striving towards excellence. As we communicate and in the professionalism we bring our patients practice. Thank you.